Hi, my name is CJ Devgan, and welcome to Season 2 of Breaking Barriers. My goal for Season 2 is to discuss how digital transformation is redefining how care will be provided in the next 5, 10, and 20 years. I will be talking to leading minds in the healthcare sector and exploring how new disruptors are leveraging technologies such as artificial intelligence, population health, blockchain are reshaping the healthcare universe.
Welcome to episode number 6 of our show. Topic for this week is the significance of interoperability for digital healthcare system. I have been serving healthcare sector for close to 25 years, and it pains me that majority of healthcare data is still living in silos. Most of the providers are still providing care to their patients with limited insight into their complete medical history. For example, if I get admitted to an hospital tomorrow, my hospital provider will have no knowledge of my past diagnosis or medications that I may be taking, or even the name of my primary care physician. Similarly, there will be no alert sent to my primary care physician that I have been admitted to an inpatient facility, so that he can ensure that I am receiving the appropriate level of care. Not only that, my family physician will not receive information regarding my diagnosis or things he may need to watch for after my discharge from the hospital. So, in case my health is not improving, he can intervene and help avoid rehospitalization. Various studies have shown that to improve patient care, we must advance coordination of care across the care continuum. Why? Because when providers can view a complete picture of their patient's medical history, it allows them to make informed and timely decisions and deliver quality of care their patients need. The result of this is a healthier population and lower financial cost for our system. So you may be wondering, with all the technology advances, why is it so difficult to exchange data between providers? Isn't most of the other businesses doing it today? The impediment is not lack of technology, but lack of incentive for providers to share the data that they are collecting. Therefore, in my point of view, we need government agencies and regulators to intervene. We need them to devise a mechanism that encourages providers to send and receive medical history of all their patients. And we shouldn't stop at just sending and receiving data. We want to make sure that receiving providers are actually integrating that information into their medical records. There has to be a way to measure, so we as a system can reward those providers who complies and penalize those providers who fail to share and integrate their patients' data. So far, I have only discussed integrating data between providers. But the future of digital health is beyond that. Why? Because majority of data in future is going to be generated by the patient themselves. How? Through wearables, watches, sensors that we are wearing on our bodies, sensors that are going to be in our surroundings capturing data about our health and well-being. So therefore, we need to find a mechanism how to integrate that data. But before we find a way to integrate that data, we need to understand who owns that data, how do we associate that data to a patient, where is that data actually being stored today, and then we need to figure out how to make sense of this large volume of data. We will cover all of this and more in another episode. As I close this call today, my call to regulators are twofold. A, help define standards to transfer data, and vendors to agree and develop systems that can support these standards. And two, most critical, devise mechanism to reward or penalize providers who are not exchanging and integrating this data.
That is all for today. Thank you for listening. If you are a healthcare executive and grappling with challenges to transform your organization, contact me and let's talk. If you like our show, please subscribe, leave a rating and a review for us on iTunes. Ciao and have a productive week.